On March 15, 2018, a federal judge in the heart of the Midwest ordered the seizure of a warehouse that held more than 500 million oxycodone pills, enough to give every resident of a small town of 3,000 people a 10-day supply of the powerful opioid. That staggering figure was the first public glimpse into a hidden empire of pills, profit, and deception built by a single corporation, Mallinckrodt Pharmaceuticals. Mallinckrodt, once a modest chemical company founded in 1867, had transformed over the decades into a global manufacturer of specialty pharmaceuticals. By the early 2000s, the firm's flagship product, the extended-release formulation of oxycodone known as Oxycontin, sat at the center of a burgeoning opioid market. The company's executives saw an opportunity not merely to treat pain, but to dominate a market that was expanding faster than any other prescription drug category in America. The story begins with a simple, yet ruthless business model. Sell as much drug as possible, as quickly as possible, and then convince insurers, doctors, and patients that the product is indispensable. Mallinckrodt's sales force was incentivized with bonuses tied to the volume of Oxycontin prescriptions they secured. In towns across the nation, sales representatives held lavish lunches, funded continuing education seminars, and even paid doctors to become key opinion leaders. The result was an unprecedented surge in prescriptions, many of them for patients who had never required such potent pain relief. Behind the glossy marketing materials lay a darker reality. Internal memos, later uncovered during the investigation, revealed that Mallinckrodt executives were fully aware of the drug's addictive potential. Yet they pressed forward, encouraging off-label uses, prescribing the medication for conditions it was never approved to treat, from chronic back pain to postoperative recovery, despite no scientific evidence supporting such practices. The company also employed pay-for-delay tactics, paying generic manufacturers to postpone the release of cheaper alternatives, effectively locking patients into costly brand name prescriptions. By 2016, the opioid crisis had erupted into a public health emergency. Overdose deaths were climbing at an alarming rate, and the Centers for Disease Control and Prevention identified prescription opioids as a leading driver. Lawmakers began to turn their attention to the pharmaceutical giants fueling the epidemic. In 2017, the Department of Justice launched a sweeping investigation into the nation's top opioid manufacturers, Mallinckrodt among them. The investigation uncovered a web of deceit that stretched from the boardroom to the pharmacy counter. Prosecutors presented evidence that Mallinckrodt had shipped more than 2 billion oxycodone tablets across the United States between 2006 and 2015. Of those, a staggering 500 million pills, equivalent to roughly one pill for every American adult, had been sent to a single county in West Virginia, a region already ravaged by addiction. The sheer volume was not a mistake. It was a calculated move to saturate a market that could sustain high profits. In 2020, the case reached the courtroom. The trial, officially titled United States v. Mallinckrodt Pharmaceuticals, unfolded before a federal judge in the Eastern District of Missouri. The government's case hinged on three core allegations: illegal marketing practices that encouraged off-label use, a scheme to conceal the drug's addictive risks, and a pattern of over-distribution that flooded vulnerable communities with excess pills. Witnesses included former Mallinckrodt sales executives who testified about the pressure to meet aggressive sales targets, as well as doctors who admitted to receiving undisclosed payments for prescribing the drug. Mallinckrodt's defense argued that they had complied with all regulatory guidelines and that the opioid epidemic was a complex, multifaceted problem that could not be pinned on a single manufacturer. They claimed that the high volume of shipments was driven by legitimate medical demand, and that any adverse outcomes were the result of patient misuse, not corporate malfeasance. After weeks of testimony, The jury deliberated for just under 2 days. When they returned, the verdict was unequivocal. Mallinckrodt had engaged in a fraudulent scheme to market Oxycodone, knowingly misled physicians about its risks, and contributed significantly to the opioid crisis. The court ordered the company to pay a historic $1.6 billion in civil penalties, one of the largest settlements ever reached in a pharmaceutical case. In addition, Mallinckrodt agreed to a series of non-monetary relief measures, including a comprehensive monitoring program for opioid prescriptions, the implementation of stricter internal compliance protocols, and a commitment to fund treatment and prevention initiatives in the hardest-hit communities. The aftermath of the verdict sent ripples through the pharmaceutical industry. Shareholders watched the company's stock plummet, and the settlement forced Mallinckrodt to restructure its debt, selling off non-core assets to stay afloat. The case also spurred a wave of similar lawsuits against other opioid manufacturers, creating a cascade of legal and financial pressures that reshaped how the industry approaches drug marketing. Beyond the balance sheets, the human impact remains stark. In the West Virginia county that received 500 million pills, overdose rates spiked dramatically in the years that followed. Families lost loved ones, emergency rooms overflowed, and community resources were stretched thin. The settlement money, while substantial, is only a fraction of the societal cost, estimated in the hundreds of billions when factoring in healthcare, lost productivity, and the intangible toll of grief. Yet there are glimmers of hope. The mandatory monitoring programs mandated by the settlement have begun to reduce inappropriate prescribing patterns in several states. Funding allocated for addiction treatment has expanded access to medication, assisted therapy, and counseling in regions that previously lacked such services. Subscribe to The Verdict for more stories like this.